David Hertel in for Aaron and Natasha. And as we know all too well, you never know when illness can strike, and that can be a challenge for patients and their loved ones. This can be particularly hard for the most vulnerable members of our community, especially around the holidays. Did you know that the MUHC has dozens of social workers that offer important care to patients and their families during their illness? Social Services offers financial support for families, transportation and groceries, and much more. So, what does Social Services do exactly to help the most vulnerable patients and their families while they're going through treatments? And what can we do to help support this fantastic initiative? Joining us is Elaine Jones, Department Manager of Social Services at the McGill University Health Center. Thank you for joining us, Elaine.
Thank you so much for having me today.
So I just talked about a few examples of what social services offers when illness strikes, but maybe you can give me more examples. I mean, about everything, because we often hear about this. Social services, social workers. I mean, what is your day like? What is the usual day of a social worker like?
That is such a great question. So in social services, our day is different every single day. We really see some of the most vulnerable people in our communities. People who have very little are often homeless or alone or struggling. Sometimes we see patients who have mental health problems like depression or who are trying to get out of a violent relationship and just need a little help. So that's what a social worker does. When people are dealing with an illness, it's sometimes very difficult for patients to navigate the different services out there and to get the support that they need. So a social worker is really there to help them to navigate that and make sure that they get the support that they need so that they can focus on their health.
Right. And what fascinates me is you get the case, and I mean, you have very little reaction time sometimes, right? You're brought in and you just, okay, here's a patient, and you have to understand that patient and his or her situation and be able to come up with answers fairly quickly, right?
Yeah, so social workers, we sort of call ourselves the problem solvers of the hospital. That's sort of our expertise, or sometimes we even refer to ourselves as detectives, because we have social workers who are really part of almost every multidisciplinary team across the hospital. So we have social workers who are there in the front lines, in the emergency department, in the intensive care unit, in the oncology department. We're really in almost every single team across all of the hospitals. And we just jump right in and try and get to know our patients and really assess exactly what their needs are with the multidisciplinary team. And we just, and every patient is different and unique. And we really try to be very patient focused so that we can understand what exactly the needs are of each patient and how we can help them to either get the right care or to be discharged safely or to really navigate sometimes what seems like a really complex healthcare system.
So how many social workers are there at the MUHC?
We are a really large department, growing actually. We have 70 social workers who work just for the adult services, and we have about 20 who work in the children's services.
And growing, if you're growing, that means there's a lot of demand for your services, right?
There sure is. There is never a quiet day in social services. We have, unfortunately, also, given the pandemic, the need for more support in mental health and also, in a lot of the, accessing care and services has really meant that social workers, there's a higher demand, and we're absolutely in need of social workers. Almost every team says, is often asking for added help. So we're definitely there to help everyone.
And this is another expression. Like I see this, and even when I was in politics, I mean, we talk about vulnerable clienteles, vulnerable patients. I mean, what kind of challenges are we talking about when we talk about vulnerable patients?
Well, we have people who are sometimes homeless or have very complex healthcare needs, people who are having difficulty. When you're very sick, it can be very hard and stressful to look after yourself, let alone to look after others. And so some of our patients are really struggling either financially or with their social support networks. And sometimes we have people who also get very sick and can't go home and need to find a place that is safe for them to go. So we really do help people from all ages and in all different social and economic situations. People who are also new to the country and maybe don't had to flee or are suffering or here and need a little bit of assistance. So we really are. We really see a very large variety of patients who need our help.
Speaking with Elaine Jones, Department Manager of Social Services at the MUHC. So, Elaine, what's the most rewarding part of your job? Because let's not mince words, this is a tough job. This is difficult. This is hard work. The entire healthcare system is presently, as we all know, very pushed to its very limits these days. But and you're part of that effort. I mean, but when you come home, I mean, what gives you hope? What makes you feel good about this job?
Oh wow, I won't. Okay, so honestly, I go home every day exhausted.
Yeah, I can imagine.
We're just working so hard all the time, but it is such a rewarding part of I love that question because there's so many things that I find rewarding. Like, first of all, at the MUHC, we have an amazing team of healthcare professionals who are truthfully at the top of their leading experts across the world. But even more, I would say it's the patients. Honestly, the most rewarding part of my day is when I get to hear from patients who, were really struggling, but who then take the time to thank the team for just the very little things that we do. And honestly, these are the moments that make my job so rewarding. And I feel very privileged because I'm one of the lucky people who loves my job, and I get to go to the hospital each and every day and know that I'm really making a difference in people's lives and helping them to take the stress out of being sick and getting them, being able to provide them with the help and assistance that they need.
And I'll end on this. How do donations to the MUHC Foundation help social services?
Honestly, I don't think we could do it without the donations that we receive from our very generous donors. They help us take the stress out of illness. We have patients who come sometimes for very specialized care from far away from their homes, who are barely making ends meet, who have very little in their lives. And sometimes the stress of just, am I going to be able to make it to an urgent medical appointment? Or am I going to have a healthy meal or a safe place to sleep? And without the donations that we receive from our donors, we wouldn't be able to give and help families the way that we do right now, each and every day. And especially over the holidays, it makes such a difference in each and every patient's life. And it makes our job so much easier because we know that we have something that we can help provide to our patients when in their most desperate times.
Well, Elaine, thank you so much, first of all, for all the work you do, you and your team, the fantastic job you're doing every day. Keep it up. I know it's not easy. Thank you, and thank you for sharing your experience with us today.
And thank you so much for having us.
All right. Take care.
Bye-bye.
That was Elaine Jones, Department Manager of Social Services at the MUHC. David Hurt.